Hello everyone, I'm Dr. Tiffany Tan and I'm a general dentist here at Dental Designs Clinic.
And I'm Dr. Noah. I'm a specialist in oral and maxillofacial surgery in the clinic.
Today we are here to answer some common questions about wisdom teeth surgery, the
Good and the bad.
Wisdom teeth removal is unbearably painful.
This is the number one question I get. And the answer is false. In fact, most of my patients are relatively comfortable for the entire surgery. For the whole procedure, most of the time you just feel pressure, vibration, and some movements. Our modern understanding of painkillers compared to 10 years ago has enabled us to synergistically combine their efforts and keep you very comfortable during the healing. Now, even if you're allergic to some medicine, it doesn't mean that all is lost. In fact, you can still be comfortable.
I don't need to extract wisdom teeth if there's no pain.
Well, it really depends. Some wisdom teeth do get painful and need removal because of jaw cysts or even tooth decay or infection if they're neglected. And I got this patient who had a jaw cyst which developed so huge because he neglected and procrastinated for a long time. So my advice is, even though there's no pain, get it checked by your dentist.
That's very true. So even though there are some situations where you don't need to remove your wisdom teeth, but always ask your dentist as he will know the situation best. We are here to keep you healthy. Okay, wisdom teeth removal is scary. Yes, this is something that many of my patients are worried about.
I do agree. Most of the time it is because of the noise, and especially so if this is your first time. But with a specialist or a very experienced dentist, it could all be all over in 15 minutes. You usually could experience loud or unfamiliar sounds or sensations. But in any case, if you're really scared, we can offer you the option to do this asleep so that you won't know anything at all and wake up after it is all done. And I promise you, you will not wake up halfway like what many people say, and we will make sure that you are all comfortable and safely asleep.
Risky wisdom teeth should always be left alone.
It depends actually. You see, some patients have been told that by well-meaning dentists. But if you don't monitor this and you leave it alone for a long time, it could lead to serious problems.
As a general dentist, we always see wisdom teeth in our patients, and we will always let you know the pros and cons of leaving the wisdom teeth there. And if the tooth is in a risky position, which is close to some important structures, we can refer you to a specialist to take it out.
Yes, specialists have a lot of experience doing this because we train long and train hard for these situations. We modify our techniques to keep the risk to the lowest possible.
Seeing a specialist for wisdom teeth will cost me a lot of money.
I understand your concern. You see, for Singaporeans and permanent residents, most of your wisdom teeth surgery fees can be offset from your MediSave account. In Dental Designs here, dentistry is passion. We exist to help our patients receive treatment in a safe and comfortable environment. So, our fees are structured to help you so that you don't need to worry about affordability. On that note, most of your surgery fees could be covered by even sometimes your medical insurance to keep it more affordable.
Yes, actually specialist treatment can be very affordable, so we are always here to help. Only teenagers need their wisdom teeth removed. Oh yeah, actually a lot of people ask me this.
Yeah, it's actually true. But many patients that are above 30 years old are surprised when they are told that they have wisdom teeth problems. Being matured does not mean that you will not have problems with your wisdom teeth. So, my advice, get your x-rays done every year or few years because that's the best way to see hidden problems.
So every time you come for your routine x-ray, we will always check and let you know if you have any wisdom teeth or if they are going to cause any problems for you. My parents didn't need to remove their wisdom teeth, so I will not need to remove them.
Great question. You see, in the good old days, many people lose their teeth very young. So when it is time for the wisdom teeth to come out, the wisdom teeth can erupt into position very nicely. But you see, nowadays we are so lucky. We get to keep all our teeth because we see the dentist from very young. So for some of us, when the wisdom teeth develops, it will cause problems because then it will no longer have enough space to come out.
Taking out wisdom teeth asleep under general anesthetic is not necessary and is dangerous. Well, there's two ways to take out wisdom teeth. One is under local anesthetic, where the part of the face and the teeth are numb and you are still conscious when we take it out. The other way is by general anesthetic, where you are fully asleep and we take it out while you're asleep.
You know, I have patients who especially request that they are asleep and are totally unaware when they do this. And I do identify with them because I was traumatized as well. I was traumatized by my dental nurse when I was in primary school. But for these patients, when they wake up after their surgery, all comfortable, no pain, they tell me it is all worth it.
I think that's really, really important. So many patients are also concerned about the safety of having general anesthetic.
That's a great question as well. You see, general anesthetic or sedation is safe when it is performed by an anesthetist. These doctors are specially trained to make you comfortable and safe when you sleep. So they do assessments and take safety safeguards to make sure that you stay safe. And you won't even feel any pain when you wake up, because after you sleep, we will give you special painkillers, medicine, so that you wake up all comfortable.
I'm worried my body can't take so many extractions at one go.
That's an understandable one. Many people are worried that when you take out 2 or 3, that your body can't make it. But you are strong, and most patients remain comfortable and can even post on social media when they are home.
I even have patients that request to take out 4 teeth at one go because they just rather have it all over and done with, and after that the healing is also good. But of course, if you are worried, you can choose to have it taken out one by one, or you can also choose to have one side first, that means the top and the bottom on one side, so you can eat on the other side.
On that note, sometimes even though there will be swelling, soreness or stiffness, but it's usually not that bad. So discuss your painkilling options with us, and we will be sure that we can take good care of you.
I'm condemned to a liquid diet after the surgery.
Yeah, many patients do worry that they will have to just eat liquid diet for the whole week, but it's not necessary for most people. I usually ask my patients to start with food that's easy to manage because of the new eating pattern. If you like, you can eat ice cream, milkshake, sorbet, and chocolate, all delicious stuff. And if you really feel hungry, you can also eat something softer like tofu or even eggs. As long as your food is room temperature or colder, there's no problems. And once you get a hang of it, you can go back to your normal diet.
Maybe it's a good time to start a diet as well.
I agree. So, we hope we have been helpful today in answering some of your concerns.
If you have any further questions, you can always look on our website, or you can come visit us at Dental Designs Clinic. We hope to see you soon. Bye-bye.
Bye.